Morning, and thanks for coming. Just like to welcome you to sharing our, actually, Young Devon's been operating in Devon for about 60 years, so I think we're a very resilient organisation that's managed to survive over the years through many changes. So in the short time that I've got this morning, I just wanted to give you a snapshot of how Young Devon supports the mental health and the well-being of young people in Devon. So it's a bit of a quick run through some of the key services. Obviously, Young Devon, we provide a lot of direct work to young people. We do this in a number of projects. Clearly, the counselling and psychotherapy service is focused on the mental health and well-being of young people. There are other projects that Young Devon's been involved in running and managing and delivering. For example, the risk and behaviour, the R&B project, which has been very successful over the last couple of years. And that's been targeted to vulnerable people, young people who are at risk. We've also been working closely with Devon Children and Young People Service around the issue of transitions and supporting children and young people with additional needs in that very difficult period when they have to move from young people services into adult services. And of course, we know that and understand this is still quite a challenging situation. The other example I wanted to just give you this morning was we're also involved in trying to do innovative work, and we're part of the national pilot run by the Expert Patient Programme who have successfully developed group work for adults with mental health problems, and we're piloting this now for young people, trying to modify that approach so it's suitable for young people. So there are specific projects which Young Devon's involved in, which are targeted at the mental health and emotional well-being of young people. I just also want to say that, I mean, there are other, great projects and services within Young Devon, and we know that there are a lot of young people who have a range of emotional needs which need to be met. We know from our supported lodging schemes, from our supported housing schemes, that there are young people whom we work with who have got, for low-level emotional needs right through to very serious mental health problems. And we also know from our data that we collect and from anecdotal data, evidence that there is a lot of young people in Devon across the county who don't access services but who have considerable emotional needs. These are young people. We come across them in the counselling service. And I'll come on to that later on. I'll come back to the counselling service. So we know that there's a high level of need. We know there's a lot of young people out there who need support. And I think one of the key factors I wanted to flag up today was the importance of the workforce. That's the adults who work with young people. Because underneath all of this, how we can support young people is basically has to stem from relationships. So good relationships, meaningful relationships, trusting relationships is what is the foundation to supporting young people. So that's on a local basis. We're also involved on a more national level. Excuse me. Young Devon's leading a mental health project for Clubs for Young People. Now, Clubs for Young People is an umbrella membership organisation. It has over 3,000 members. They're all voluntary youth clubs spread across the UK. This project's called Somewhere to Talk, Someone to Listen. And I think this sums up to the key aspects of supporting young people's emotional well-being. They need someone who can listen to them, who can listen and understand, and somewhere safe where they can talk, where they feel safe to talk to someone that they can trust. Now, this is an ongoing project for another 18 months, but we've just reached the stage of producing an interim report which is available for anybody here. It's hot off the press, so you're the first people to see it. And it highlights the value of youth clubs in supporting the emotional well-being of young people. So when we talk about the value of youth clubs, we're actually talking about the value of the youth workers in those youth clubs in supporting the emotional well-being of young people. This, the report, just to briefly mention the fact that we've based this report on a literature review undertaken by the Mental Health Foundation, and it has actually produced evidence of the value of, I think, generic youth work, broader than youth clubs, in supporting the emotional well-being of young people. So I hope you find that report interesting and helpful. Back to the counselling service. Young Devon is a significant provider of counselling services to young people in Devon. And we operate in 9 market towns, mainly in the south and west, but also we've recently, through working in partnership with other voluntary organisations, managed to secure a little bit of seed cord funding to get some counselling available for young people in Barnstable in North Devon, which has been sort of neglected for many years. We also operate through the F Centre in Exeter and in Exmouth. So we cover a fair chunk of Devon. Some idea of capacity. In 2009, we saw over 700 young people. We also delivered over 4,000 sessions, counselling sessions. So we're quite a significant provider of counselling in Devon. And one of the key features of the counselling service is the fact that we really rely on volunteers. So we have currently 25 volunteer counsellors, and more than half of those are qualified diploma counsellors. So I want to recognise the importance of those volunteers who commit their time, and we give them support. I wanted to just home it down because we get funding to deliver counselling from different sources. And I wanted to look more closely at the South and West Devon model because, as far as my understanding about the big societies is, I mean, it's all evolving. I think it's all evolving. My understanding is that it's about value for money, it's about using volunteers, it's about a number of things. I think this sort of fits in quite well. In the south and west of Devon, we get money through a service level agreement from the PCT. In effect, we're subcontracted to deliver counselling and psychotherapy in the community. We also do our own local fundraising, so we supplement that. This is very good value for money. For each session that's delivered, it costs about £35, inclusive of all costs.